the compliance, the basic standard of the care. Then you got this other group that's a new patient that accepts the basic standard, but they need additional attention. They've even expressed some interest in getting that, but they've not actually been scheduled for that. And then you've got the other new patient group that denies treatment altogether. Again, part of what their effort is trying to identify these groups so that they can maybe go after them in different ways. Because you don't want to have the same message for everybody. It just doesn't work. You have to individualize the way you go after these different folks. And really, what about the folks that say no? There is growth available in how you deal with no. How are you dealing with no? What are you doing about no? Because no doesn't mean no. Sometimes no means I don't know. I don't know what it is that you're asking me to do. I don't know what I need to do. I just know I don't feel like spending a bunch of money for somebody I don't know. And it's really not selling unwanted treatments. You can't sell them something they don't want. Okay? It's not about that. That's not really what this is about. It's really about staff training and education, because that's your front line. That's where it comes down to. What kind of training are you doing? What kind of education are you providing? These kinds of forums like this, phenomenal. I think the conversation, that was had about having two people membership and being able to be sort of like the point person and help bring in the right staff depending on the topics, invaluable. That would be a huge asset for any practice. Do you have staff that are designated for follow-ups? Do you have, within your practice, do you have certain people that these are people, this person is well educated and trained and has dealt with these kind of issues, so I'm going to have them deal with this type of patient and follow up. You got this person in the practice that really understands this issue. They've had something before, so I'm going to have them follow up with these people. Have you thought about maybe breaking up your staff in the way that they are dealing with your patients? Or do you just have the one person that's calling everybody and you're treating everybody like they're all the same? And when you have these discussions, really, I sort of threw this out, is really, each of these conversations really needs to include the advantages of whatever it is that's been brought up, the disadvantages of that whole topic, some discussion about what their feeling is, their understanding, so you get an understanding of whether or not they need more information to help, and then possibly even an experience that you've had yourself. Again, another area where if you know your staff and you know what kind of experiences they've had, either themselves personally, with their family, or with other patients there, those kind of experience speak volumes and help you overcome some of these issues. Nodding your head, you've seen this work. Because communication, the 3 C's. Communication. Key to acceptance of any recommendation. The person that says no is the person that didn't know. Right? Value versus price again. Circling back around to this whole notion of value. And I'll challenge you with this statement here. Value of service outcome is entirely determined by your clients. Entirely. In fact, the staff that delivers that product, they can only be in charge of and only be a determinant of the price. Think about that. The value of the service outcome. When you think about it like that it's entirely determined by the clients, you don't have any control over value. You don't. Because value, whether it's real or perceived, is the customer's. They're the ones who's making a determination as to whether or not there's any value at all with what are you doing. The service that you're doing right now. You are attempting to convey something that you think is valuable. But the question is, do your consumers, do the folks that come in that receive this service, do they see it as a value? And what sometimes gets lost, and not saying I'm just using you, Gail, because you're very vocal and you'll tell me to shut up if I need to, is that, I can already tell, is that sometimes we implement these value propositions, these things that we feel like will have value, but do we talk to the customers, the consumers, after the fact? Do we ask them after we've implemented it? Now, you can wait a little bit, work out some of the bugs, if you don't want to get any bad news about the bugs. If you want to take longer to get the bugs worked out, wait a little bit. But do you ask? Do you say, we've implemented this. You may have noticed this about 3 months ago. What do you think? Do you find it of value? Get into their heads. They're the ones that are making all the decisions. They're the ones that are deciding whether or not they're going to bring more people to you. How do your customers judge the quality of your work? Have you looked into this? Have you asked? Have you tried to find this kind of information? Because if you don't know, it gets back to what gets measured gets recognized. What gets recognized gets repeated. And the question really is a neuter a neuter as far as your customer is concerned? Because you know it's not. You know it's not, but does your customer think a neuter is a neuter? How do you educate? Yes, ma'am.
We've actually, we used to just take a call back and then give us a call that would change that. So when new calls immediately before all of this, the receptionist just has a little cheat sheet and use $250. Period. That's it.
Yep.
No specifics, no how we do it, take into consideration this and this, nothing. So people did exactly what we were teaching them to do. Price shop.
Yep.
Oh, $250 there. If I'm going to call over here, it's $275. Little do they know the $275. Those are whatever it is that they do, and it's not even in comparison to how we do it. So we significantly changed how we talk about things. And we go through every single detail and make it valuable, which is extremely valuable. The way most of us would do surgery. So that has really changed the perspective altogether. Actually increased people not only picking us among the 12 veterinary clinics that are around us, but also the things that they're optional that we offer the clients. They're more apt to choose that than not.
Part of that education up front, letting them know that it's not all the same, that these are some things that you've thought about, that you're willing to educate and take the time for them to do. And at one point, it was a decision of, let's just tell them what the price is and go on because we don't have time to do this, because we got to get to everybody. And then it was like, no, we need to educate people. We need to spend a little more time. And that turns out to be what becomes more valuable for the practice in the long run. Short run and long run, it sounds like.
But we divided up who got it now. We used to just see whoever got a chance to. And now my doctors pick ones that are sick and I see whether they want to talk to, my technicians do, my heartworm people involved well visits, and my receptionist do the boarding and the grooming and that stuff. And by doing that, we've already heard people going, what? Dr. Simpson called me here.
Yep. And that gets back to the whole point of matching up the people with the experience, the proper experience to discuss those with the people that need that education and have that experience. Very good. The internet, again, it's a double-edged sword. The question here is, what are you doing to leverage the internet? Is your website a glorified banner? Are you looking to keep that information up to date and refreshed? Does it truly reflect your practice? And by that I mean, does it help the customer, the possible consumer, go beyond just the waiting room? Because realize 90% of your people know your practice by one little small room. The only chance for them to really see into what the rest of this practice looks like is sometimes on your site. Is it user-friendly? Is it easy to navigate? Are the things that they're looking to use, that they use more often, is it easy to get to? Do I have to go through 3 different places in order to get to the one thing I need? Does it educate your clients? Because as we keep talking about, that communication is key. What are you doing to educate those clients about certain topics, topical topics that make sense around the time frame that you're in? Are you changing it up? You're looking at vaccines, core versus non-core. As people are starting to look at these kind of packages, are you giving them some education as to what is critical and what are some things based on possibly, and this is one that I've heard a number of folks looking at, are you doing lifestyle assessments? So do you talk about their lifestyle and their pet's lifestyle as a way to introduce some of these things that are critical based on the lifestyle? Now again, it's another way of looking at it. It's the glass half full rather than glass half empty. It's the potato versus potato. But if you go after, the conversation, the educational points, looking at it from a lifestyle scenario, maybe they'll be more receptive to some of the other things that you're bringing up that have impact. Yes, ma'am?
I've had a little bit of, we, I should say, our clinics have had a little bit of negative and positive disruption to the lifestyle changes. Because we've seen a correlation with the lifestyle. A dog, for example, you've got the Maltese who's goes on bed, practically in the bedroom, basically never touches the ground outside of their house or apartment or house. Versus your outdoor dog, who basically outside 3 acres to run how much you want to, and we've seen a comparison in between the lifestyle setting that we're starting to offer, and we realize we need to back off of that, is that 9 times out of 10, the dog that's in the house probably needs less in terms of protection than the outdoor dog. But again, the idea of value for an owner who houses and well and dressed and bed and all this stuff, they want everything. The outdoor dog, you know what? He's an outdoor dog. And he's the one that needs tremendous amounts. So that's kind of backfired on us a little bit.
It may be, again, part of that communication, part of that description of what it is. Maybe it gets back to some of the experiences that maybe that could be identified, that's showing that these pets that have this kind of exposure do have these kinds of major issues that you need to be concerned with. Now, if you want to change that, if you want to bring the pet in and have its own bed and have this, then we're seeing that this is probably the adequate way to go about it. So, you're sort of making a decision for your loved one in this case.
Particularly on our dog side, lifestyle and look, and risk that they have. And when they go, those dogs. One of the things I always go to all this, you live in Georgia, congratulations. Your dog's supposed to explain to you because there's 90% run off of it. And we're with the dog in the apartment. He's day outside, he's got probably anything on there. And it really did help. Sometimes we don't know. So I can spend a little bit. And they're going to be sitting together. I put it together, and then on the bottom I put, like, so a dog is supposed to want to use, I put average cost of treatment versus your time from and it really helps.
Is there a resource on your website or within your group that some of these kind of ideas can get poured in and made accessible